Good morning, everybody in the house. I'm presenting an article on incidence and management of low back pain among nurses in Obafemi Awolowo University Teaching Hospitals Complex, Ile Ife and Ilesa. My name is Oyedero Lolade Comfort, and I'm a master's student in the Department of Nursing, Texila, American University. Next slide, please. Next slide, please. Next slide. Next slide, please. Next slide, please. Next slide. Next slide, please. Next slide. Can you please send the next slide to me? Mo present lọ́wọ́ ma.
Miss Comfort. Okay, move the slides also.
Okay. Introduction. Low back pain is the second most common diagnosis after upper respiratory diseases, and this was written according to Karana and Beraka 2004, and it was also discovered that nurses are ranked third on the prevalent rates of low back pain among the employed people, and this could be probably as a result of the fact that nurses, they care for patients, they stand all of the time, and they carry out virtually all the procedures, and they stayed, several hours with their patients on the ward. So this could lead to the effect of low back pain that many of them experience. Next slide, please. Next slide. Next slide.
Hello.
Hello.
I'm watching you.
Okay.
Hello, I'm watching you. Just the arrow is by your left.
Hello.
Arrow by your left hand side down. Be pressing it. I'm watching you. There's an arrow down by your left hand side.
Mario.
Yes. Warrior arrow don't point down. Open that beside you can inside the map right there.
Okay, mo ti press ẹ báyìí.
Just click on it. I'm not saying what.
Mi rí àrò yẹn ò bóyá lè yọjú sí mi lọ́fíìsì o.
Okay.
Mi rí àrò. Next slide. Hello. Yes, the summary of the work. The study looked at the incidence and management of low back pain among nurses in Obafemi Awolowo University Teaching Hospitals Complex, Ile Ife and Ilesa. This hospital is in Osun State, Nigeria, and it has several two different major hospitals and community primary healthcare sessions, and the target population were nurses employed and working with the institution. Now, a descriptive design was used for the study, and a simple random sampling technique was used to select 255 nurses in Ife Hospital Unit and Westgate Hospital Unit. If you remember, I said this hospital has its headquarters in Ife, and there's another one in Westgate Hospital. So nurses were selected from these two hospitals. Now, part of the summary, the target population, I've mentioned this. Now, it was also discovered that said administered questionnaire was used to collect data, and analysis were done using descriptive and inferential statistics. Finding from the study revealed that 71.4% of the respondents had low back pain, among which 68.7% had low intense back pain, while 27.5% had moderate intense low back pain, and only 3.8% had high intense low back pain. I've seen it. Now, summary still continue. We also find out that the findings will provide basic knowledge of factors associated with low back pain among nurses. We want to delve into this by, actually finding out what has led to incidence of low back pain among nurses. So it will also help in planning accurate intervention upon which specific educational programs will be designed for nurses that work in the hospital. Now, what are the problems? The European Foundations for the Improvement of Living and Working Conditions in its European Occupational Diseases Statistics. This statistics was obtained in 2007, and it stated that about 35% of health workforce are faced with musculoskeletal disorders, among whom low back pain is the most significant health problem. As part of the problem, today, intensification of work, changes in scheduling and organization of workplace, and rising demands on employees, as well as new technologies, led to situations characterized by additional pressure and stress. And as a result, more and more occupational or work-related diseases have appeared, and one of which is low back pain. Low back pain is a well-recognized cause of morbidity in the industrialized world, where several studies have reported the occurrence of low back pain in general population and in occupational setting. And as part of the problem also, we saw that low back pain is a common cause of morbidity among health workers, and it is not uncommon among Nigerian nurses. And no wonder when many of them retire from service, they come back to physiotherapy department, to complain of low back pain and to be attending physiotherapy exercises. Now, what methods did I use? A descriptive design was adopted for the study, and 258 respondents were sampled using a simple random sampling technique. However, 255 respondents filled the self-administered questionnaires given to them, and the data was analyzed using descriptive and inferential statistics, and results were presented in tables using frequency and percentages. Now, the results and discussion. Low back pain is a common cause of morbidity among health workers and nurses, and among the occupational groups within the health service that are vulnerable to low back pain. And this was discovered by Cunningham et al. 2009 in the research that they carried out. Now, as part of the results and discussion, we also found out that from the study revealed that 71.4% of the respondents had low back pain, among which 68.7% had low intense back pain, while 27.5% had moderate intense low back pain, and only 3.8% had high intense low back pain. Now, we also found out that nursing procedures that require lifting, that requires bending, were found to be associated with low back pain. And we also discovered that wound dressing and bed making were one of the nursing jobs that were identified to be associated with this means of low back pain. Now, as to the first research hypothesis, the significant value of the F test in the ANOVA table is lesser than 0.05, and thus we reject the null hypothesis and conclude by accepting the alternative hypothesis that there is a significant difference between stress and low back pain intensity. And this made us to reject the null hypothesis and conclude by accepting the alternative hypothesis that there is a significant difference between stress and low back pain intensity. And the Pearson chi-square was used to test the hypothesis that there is no significant relationship between what and low back pain intensity. So the Pearson chi-square derived a value of 4.861 and the degree of freedom of 7, and a significant value of 0.677, and which means the significant value is greater. Now, it's a repetition. Now, in conclusion, the study concludes that a larger percentage of nurses have low back pain, and that procedures such as wound dressing and bed making are highly associated with low back pain, which makes nurses working on wards requiring these two procedures to be more prone to developing low back pain, and they manage low back pain with massage most of the time. They rest, they engage in physical therapy, and also at times they take analgesic with proven effects. And conclusion and future steps now. Nurses should update their knowledge on back care hygiene, ergonomics. This will go a long way to reduce the incidence of low back pain. Then also, compensation programs for nurses who develop serious low back pain in service should be designed and made functional. Seminars should be organized to improve nurses' knowledge on appropriate patient lifting methods. And then lifting equipment should also be provided in all of the wards, especially wards where they need to lift patients and where they need to carry some of the procedures, including wound dressing. Thank you very much. Thank you for listening. Thank you. I appreciate you all.